what exactly is depression. And a lot of times we use the word depression very loosely. I'm depressed, or so and so person is depressed. But if we understand what the term means, it originates from a very strong level of sadness and emptiness that a person feels. So while we all experience sadness, we all go through highs and lows in life. We all have challenges which are big and small, and we experience sadness. We experience those lows, and it's also important to experience it, because unless I don't really know what sadness is, I won't know what happiness is in its true form. And that's the reason we have these emotions. But when there is depression, there is higher intensity of sadness. So we experience that a person might experience significant level of lows, where there is a challenge waking up in the morning, no interest in anything, constant negative self-talk, lot of tiredness, feeling of being drained, frequent crying spells, not being able to see anything positive in our life. And when that exists for 3 weeks or more, then we say, okay, you need to start really looking at what's happening. Because when that is consistently there and intensely there for a while, is when we say, okay, now you might be experiencing what is called as depression.
What's happened in this whole scenario is that somewhere glorification of mental health has started happening. Instead of breaking the stigma, I mean, yes, we are trying to break the stigma, but at the same time, now people have started glorifying. And I think social media has played a very big role in that, sadly. By, I have to say that the real culture and the posts that are there around now, it's just about so generalized, right? Everything is so generalized. It's like you see posts on like, be mindful, go out in nature, go to physical activity, you'll be fine. Anxiety is nothing. Anxiety is normal. It is true. I mean, I'm not saying that all of these things are not great. You should do all of these practices, but generalizing it, actually tells everybody that it's like one size fits all. We're telling everybody that you're all anxious. It's all the same for you, right? That one anxiety disorder is the same for everybody, and everybody is going to feel the same way. But that's not true. And now people are just Googling things online and associating with like, oh, I have anxiety disorder. Oh, I have depression disorder. It's not true. It's this is something that is very, very important, that mental health issues are actually experiential. It's not theoretical. There's a big, big, big difference. It is not about the theory. Yes, these are signs and symptoms that, anxiety disorder will have these signs and symptoms. This is just to distinguish that this is an anxiety disorder. But it's much more than that. It's an innate behavioral pattern in you, which is disordered according to you. So if I feel this is not normal behavior according to me, that can also be a disorder within me, right? Just because Google doesn't say it, doesn't mean that it's not an issue for me, right? If I'm not feeling happy with whatever, for example, I had an exam and I'm not feeling happy about how I did, I'm not feeling happy about it. Not necessarily that Google will be able to explain this exact feeling, what I'm feeling, right? So what is happening with all this real culture and Googling is now generalization of everything, of your feeling is happening through these words. And we are missing what we're really feeling again.
Subscribe to the YouTube channel and don't forget to hit the bell icon so that you don't miss any videos by us.